Hi everyone, Dr. Blied here. And today I'd like to share with you all about an emerging area of research, specifically on the physical health concerns that often accompany neurodivergence. Let's start with joint hypermobility. Most people know it as being double jointed or being able to bend your fingers back a lot further than most people can, or even doing the splits with ease. About 1 in 5 people in the general population have this kind of flexibility, but in adults with ADHD and autism, it is much more common. A 2022 study found that over half, 50%, of neurodivergent adults had generalized joint hypermobility, and for neurodivergent women or individuals assigned female at birth, that number rose to nearly 70%. For some people, hypermobility is just a physical trait, but for many others of us, it's a part of complex medical conditions such as hypermobility spectrum disorder and hypermobile Ehlers-Danlos syndrome or EDS, and connective tissue disease, and so on and so forth. These conditions can bring about challenges such as chronic pain, fatigue, dizziness, digestive issues, and anxiety. Finding providers who understand this overlap between hypermobility and neurodivergence can be quite challenging. I want you to actually check the caption for providers that I recommend in California and Washington State. Still, for those of you in other places or who don't have access to these providers, supportive treatments like physical therapy with individuals who are familiar and knowledgeable with hypermobility spectrum disorder, such as EDS, super important caveat. And also strength training, activity pacing strategies, and adjustments to your nutrition can offer meaningful and pretty huge improvements over time. Now, another area of research is inflammation. Researchers are finding that ADHD, autism, and the immune system are more connected than we ever thought. Allergies, autoimmune conditions, fatigue, and chronic pain all appear more commonly in neurodivergent people than the general population. Some of the same genes that affect brain function also regulate the immune system, which might explain the link between neurodivergence and these physical difficulties. Health concerns such as dysautonomia, which is when the autonomic nervous system doesn't regulate properly, such as in POTS, and also mast cell activation syndrome also involves an overactive immune response. These conditions, again, tend to occur much more often in people with hypermobility syndromes. And because hypermobility is more common in neurodivergent individuals, these challenges are often seen more frequently as well. In fact, most of the clients that I see in my practice who have neurodivergence also have this spectrum of disorders with EDS and mast cell activation and POTS and an autoimmune condition, or they'll come in to me with chronic illness conditions, and then we learn later on that they're also actually neurodivergent, just they weren't identified earlier in their lifetime or in childhood. Researchers, that was just a little caveat there or a little tangent. Um, Researchers are also looking at neuroinflammation, which is when immune cells release substances that directly affect the brain. This can influence energy, mood, and thinking. Hello, brain fog. So again, when we consider joint hypermobility, when we consider inflammation, and the ways that these physical concerns intersect with neurodivergence, it becomes clear that the mind and body are deeply connected. If I don't preach that enough on my channel, I hope that this is starting to all come together and make so much sense now for you. These challenges are real. These challenges are rooted in complex biology and physiology, and they deserve understanding and care. You deserve understanding and care that addresses all aspects of your health. Thanks so much for listening. Take good care of yourself, and I will see you in the next video.